Do you know how fast a single sentence can cost you thousands in benefits? It happens every day, without warning, without malice, and without most veterans ever realizing it. You sit down for your VA exam, try to be respectful, maybe even optimistic, and then casually say something like, "I'm doing okay," or "I just deal with it." You think you're being humble. The examiner writes it down. And just like that, your claim is in danger. In 2025, VA evaluations have become stricter than ever. What used to slide by as harmless conversation is now being used as documented evidence to deny, delay, or reduce your compensation. And the worst part? These aren't lies. These are honest, well-meaning phrases that are being twisted into something they're not. So if you're a veteran preparing for an exam, or you know someone who is, this video might be one of the most important things you see all year. I'm going to break down 7 innocent statements that have caused veterans their benefits in 2025. These are the exact words you'll want to avoid, or at least rethink before you speak. Because the VA isn't just listening, they're interpreting. And if you're not careful, your own voice could become the reason your benefits disappear. Stay with me, because what you're about to learn could protect your claim, your rating, and your future. It sounds harmless. You sit down across an examiner. They ask how you've been, and without thinking, you say, "I'm doing okay." Maybe you're just trying to be polite. Maybe you don't want to sound like you're complaining. But here's what most veterans don't realize. That one sentence is all it takes for the VA to decide your condition isn't serious. In 2025, VA claims are being scrutinized more than ever. The language you use during your exam is no longer treated like small talk. It's treated like evidence. And when you say you're okay, that gets written down word for word, not as a casual comment, but as a clinical assessment. It goes in your file, often next to phrases like "veteran appears stable," "no visible distress," or "reports doing well." And once that's there, good luck convincing anyone that your symptoms are severe. The truth is, veterans are being penalized for trying to be strong. The system now values clarity over modesty, and anything that sounds remotely positive is interpreted as progress, even if you're still struggling every single day. So when you say "I'm okay," what the examiner hears is, "My condition isn't affecting me that much," even if you've been living in pain, even if your mental health keeps you up at night. That one phrase can undo months of documentation, years of lived experience, and all the effort you put into your claim. It doesn't mean you should lie. It means you have to speak with intention. Be honest about your worst days, your daily challenges, and the ways your condition really impacts your life. Because when you soften the truth, you don't sound stronger. You sound ineligible. And that's exactly how benefits slip away. What most veterans don't realize is that every word counts. And "I'm doing okay" might just be the most dangerous 4 words you can say in a VA exam. There's a moment in every exam where you feel like you're saying too much. So you pause, smile politely, and say something like, "I don't want to seem like I'm complaining." You might mean it as a way to stay respectful, to avoid sounding dramatic. But that sentence does more damage than you think. Because in the VA's eyes, it's not seen as humility. It's seen as hesitation. And hesitation raises questions. In 2025, VA examiners are trained to look for consistency, not just in your paperwork, but in your voice, your body language, even your tone. When you open up about pain, anxiety, or daily struggles, and then suddenly pull back with, "But I'm not trying to complain," the system doesn't hear balance. It hears contradiction. It makes them wonder if you're exaggerating. It makes them flag your file for further review. And just like that, you go from credible to questionable. The VA process isn't built to interpret nuance. It doesn't understand that you're trying to be polite. It doesn't recognize the military mindset that taught you to suck it up and keep going. It just sees 2 conflicting messages. One that says you're suffering and another that says, "But it's not that bad." And when forced to choose, the system will always lean toward denial. What makes this even more painful is that veterans use that phrase out of character, not deception. It's a habit formed from years of trying not to burden anyone. But the exam isn't the time to downplay your reality. You're not there to prove you're tough. You're there to be understood. And when you soften your truth out of fear of complaining, the system listens to the soft part not the truth. So if that sentence is on the tip of your tongue during your exam, stop and remember this. You're not complaining. You're reporting. And if you don't say it clearly, no one else will say it for you. There's a certain pride that comes with saying, I just deal with it. It sounds strong, composed, even admirable. For many veterans, it's a way of life. Handle the pain, push through the symptoms, don't make it anyone else's problem. But inside a VA exam room, those 5 words can quietly dismantle your entire case. Because what the VA hears isn't resilience, it's functionality. And if you can deal with it, then to them, it must not be that bad. In 2025, examiners are trained to assess how much your condition disrupts your daily life, not how well you endure it, not how quietly you carry it. If you tell them you're coping, managing, adjusting, what they document is that your condition doesn't prevent you from functioning. It becomes incredibly difficult to argue for a higher rating or any rating at all if you've just explained how you manage without help. This is especially dangerous in claims involving PTSD, chronic pain, migraines, or depression, conditions that don't always leave visible scars. When you say, I just deal with it, they won't ask how hard it is. They won't ask what it costs you mentally or physically. They'll assume you're self-sufficient. And that assumption will show up in their report as justification to minimize or deny your claim. The real tragedy is that veterans say this out of strength, not dishonesty. They've been trained to be dependable, unshakable. But in the VA system, strength doesn't work in your favor. It hides what you're actually living with. And the more you downplay it, the easier it is for them to downplay it too. So when the words, I just deal with it, start come out, stop and ask yourself, what is it costing me to keep dealing with it in silence? Because if you don't speak the full truth without sugarcoating it, the system won't see it. And if they don't see it, they won't compensate it. It sounds honest, reasonable, even some days are better than others. You're just trying to explain that your condition fluctuates, that not every day is a nightmare, but not every day is easy either. But here's what the VA hears: inconsistency. And in the current system, inconsistency doesn't help you, it hurts you. In 2025, examiners are under pressure to label and categorize every condition with clarity. So when you admit that your symptoms come and go, they often interpret that as a sign your condition is episodic or mild, even if you've had more bad days than good. Even if the pain or anxiety never fully leaves, that one statement can be used to argue that you're not experiencing enough impairment to meet the criteria for full benefits. And this isn't just theory, it's happening every day. Veterans go in with solid documentation, years of treatment, and witness letters detailing how their condition affects them. But then in the exam they say, some days I feel okay, and suddenly the report reads, veteran presents as generally stable. It becomes ammunition to downgrade your claim. The system doesn't ask how bad your worst days are. It looks for any reason to say you're functioning. And when you give them that reason, even unintentionally, they'll take it. Saying some days are better opens a door for them to assume those are the days that define your life. Not the pain, not the isolation, not the panic attacks or fatigue, just the occasional good moment. And they'll use it to justify less. It's not dishonest to say your symptoms vary. It's human, but in the VA system, nuance gets flattened. So if you need benefits that reflect how hard things really are, you have to be brutally clear. Don't frame it around the better days. Describe the days that leave you on edge, in pain, or unable to function, because those are the days the system needs to understand. And they won't unless you spell it out. Veterans say it all the time. I'm not as bad as some other guys. And they mean it. They've seen fellow service members go through worse. More injuries, more trauma, more visible scars. So out of humility, they draw a line and put themselves on the lower end of the scale. But here's the problem. The VA takes that line and uses it to push your claim even lower. In 2025, the VA isn't comparing you to anyone else. They're not looking at your buddy's file or someone else's battlefield experience. They're looking at you, your symptoms, your impairments, your day-to-day struggles. So when you say, I'm not as bad as others, they don't hear modesty. They hear admission. They hear, this condition isn't severe. And once that's in your record, it's incredibly hard to walk it back. You may have anxiety that keeps you up at night, chronic pain that limits your mobility, or memory problems that make it hard to function. But if you frame it as less than someone else's experience, it dilutes everything. Suddenly, your suffering doesn't seem urgent, your needs don't sound serious, and your rating reflects that. It's a mindset that comes from loyalty, from a code that says don't make it about you. But in the VA system, that instinct backfires, because the rating process isn't about comparison, it's about precision. They're not supposed to weigh your pain against someone else's. They're supposed to assess the impact it has on your life. And when you downplay that, you make it easy for them to do the same. So if those words start forming in your mouth, I'm not as bad as some other guys, stop. You don't need to compare yourself to deserve care. You don't need to be the worst case scenario to qualify for help. You need to be honest. You need to tell the truth about your experience. Because if you don't speak up for it, no one else will. It's one of the most sincere things you can say. I'm grateful to be alive. And you mean it. After everything you've seen, everything you survived, just waking up in the morning feels like a small victory. You're not trying to prove anything. You're just speaking from the heart. But here's where it turns against you. In a VA exam, that kind of gratitude can be mistaken for stability. In 2025, VA mental health evaluations are more focused than ever on emotional tone, behavior, and verbal cues. The way you describe your mindset carries just as much weight as the symptoms themselves. So when you say you're thankful to be alive, the examiner might not hear context or trauma. They might hear recovery. They might write, "Veteran appears positive and emotionally well-regulated." And that could be the beginning of a lower rating or even a full denial. It's a painful irony. The same strength that's kept you going gets used to say you don't need help, that your PTSD isn't severe, that your depression is under control, all because you chose to focus on the light instead of the darkness. The system isn't trying to punish optimism, but it doesn't know how to read between the lines. It sees your gratitude as evidence that you're fine, even when you're not. What's even worse is that you're not lying. You're genuinely thankful to be here. But that doesn't mean the nightmares are gone. It doesn't mean the anxiety isn't real. It just means you've learned how to carry it. And that distinction, it gets lost if you don't spell it out. So during your exam, if you feel the urge to say, "I'm grateful to be alive," say it, but follow it with the truth. Let them know what you're still battling. Gratitude doesn't erase pain. It just means you're surviving it. And if the system doesn't hear both sides of that story, they'll only document the part that sounds like healing and forget the part that still hurts. There's a certain pride that never leaves you, no matter how many years have passed since you served. So when someone asks if you need help, it feels natural, automatic even, to say, "No, I'm good," or "I don't need help." But in a VA exam, those 5 words can quietly close the door on benefits you've earned, and you may not even realize it until it's too late. In 2025, one of the biggest factors a VA looks at is how independently you're functioning. If you say you don't need help, they don't see pride, they see capability. And that instantly undermines claims involving physical limitations, mental health struggles, or even eligibility for aid and attendance. Because now, in their records, you just confirmed that you're self-sufficient, that your condition doesn't interfere with your daily life, that you don't require assistance. And it doesn't matter if you were just trying to avoid being a burden, or if you were having a good day when you said it. It doesn't even matter if deep down, you know you do need help, just not all the time. Once those words are in the report, they're treated as fact. No context, no nuance, just veteran denies need for assistance. This is one of the most damaging things a veteran can say during an exam, because it cuts through everything else. Your paperwork, your symptoms, your history. It sends a message that contradicts your entire claim. And once it's there, it becomes a justification for reduced ratings or outright denials. You may think you're being strong. You may even believe it's true. But here's what the system doesn't understand. Sometimes, needing help isn't constant. It's just part of the picture. And if you don't explain that clearly, the VA won't see the full story. They'll see independence. And that's where your case begins to fall apart. So if you feel yourself want to say, "I don't need help," pause. Think about the truth, not just the pride. Because if you've been doing it all on your own out of habit, not because you're fully able, that matters. And unless you say it out loud, no one will ever know. Most veterans who lose their benefits never lied. They didn't cheat the system. They didn't exaggerate their symptoms. They just didn't realize how their own words could be turned against them. And in 2025, that mistake is easier to make than ever. You go and try and be honest, maybe even strong, and you walk out with a denial letter that makes no sense, until you look back and realize the damage was done in a single sentence. If anything in this video felt familiar, if you said any of these phrases before or know someone who has, don't ignore it. These aren't just little slip-ups. They're the reason some veterans are left without the support they earned through years of service and sacrifice. But the good news is now you know. Now you're prepared. And that small shift in awareness could change everything about your next exam. Your voice matters, but only if you know how to use it. Be clear. Be specific. Don't downplay your pain just to sound tough or polite. Because the VA isn't just listening. They're taking notes. And once it's in your file, it's hard to take back. Thank you for watching and spending your time with us today. If you found this video helpful, or if it made you rethink how you approach your VA exams, let us know in the comments. Share what stood out to you the most. Or tell us what phrase you've heard that should have never been said. Your stories not only help others, they help us create content that matters. Please take a second to like the video, subscribe, and hit the bell so you don't miss any future uploads. Your support means a lot, and it helps us keep bringing you the information that others don't always talk about, but you need to hear. Stay safe, stay aware, and we'll see you in the next video.